My name is Crystal Howard. I'm going to be doing my checkoff number 1, and first we're going to start off with the skin, hair, and nails. You want to assess your patient's skin from head to toe. You want to look at the color, general pigmentation, see if there's any areas of discoloration, and also you want to palpate the skin to see if it's warm, the moisture, the texture, how thick it is. Check for skin turgor. I always do here at the sternum. Our turgor is really good. And look for bruising, any changes in vascular, and you would have to assess the skin, as I said before, from head to toe. Any lesions, if you find any lesions, you would have to measure them, see if there's any drainage, the location and distribution of the lesions. The hair would be next. Her hair is very soft. Look through the hair for any signs of manifestations, and look at the scalp for any lesions. Next, we would look at the nails, and her fingernails are painted, so it would be hard to see. Hopefully they would be pink, and capillary refill would be less than 3 seconds. No clubbing is noted. Also teach the patient self-examinations, which they need to do once a month. You need to do that once a month. You need to look in the mirror, a big long mirror with all your clothing off, check in between your fingers, look at the bottom of your feet, in between your toes. And use another mirror to look at the back of your body also, and look for any changes in moles, anything abnormal. And you do that once a week, though, you said?
Yes.
Okay, that's really good. Next, I will go on to the head, face, and neck. You want to inspect and palpate the skull, as you would do that when you do the scalp with the hair. Any lesions, look for any lesions, as we said before. You want to palpate with the pads of the 3 fingers, the temporal artery, and the temporomandibular joint, which is right here. Is there any tenderness there?
No.
Open your mouth and close. No limitation of movement. And you want to inspect the face and look for symmetry of movements of the face. Can you smile for me? And it is symmetrical. There's no involuntary movements or edema or lesions on the face. Next, I would go examine the neck. Can you bend your neck for me? Chin down. Can you bend your neck from side to side this way and back? There's no limitation of range of motion, and her neck is symmetric. And next, I will palpate the lymph nodes, and we have the pre-auricular, the post-auricular, the submental, submandible, the deep cervical chain, the clavicular, the posterior cervical, and occipital. And one more that I wasn't familiar with, the jugulo-digastric. I think it is right through here. And her lymph nodes are non-palpable. And the thyroid gland also has to be palpated. Can you look up for me? Can you swallow? A thyroid gland doesn't look enlarged. I want to displace this side while I palpate the right side, and displace the right side while I palpate the left side. There's no nodules or no enlargement of the thyroid, and the trachea is midline. Next, we will go to the nose, the mouth, and the throat. Her nose is symmetrical, no deformity. Can you breathe through your nose for me? Both nares are patent. Okay, now I want to look her nasal mucosa is pink and moist. There's no lesions, and the turbinates, there's no exudate, swelling, or polyps. You also next would want to palpate the frontal sinuses. Is there any tenderness there?
No.
And the maxillary. No tenderness there?
Nope.
Okay. You also have to, next we'll go to the mouth and the throat. You want to look at the lips, the teeth, you smile for me, the gums, the buccal mucosa. Look for any lesions, any severe decay on the teeth, any lesions on the lips or the gums. You would want to note that. Can you say "ah" for me? The uvula is midline, and her tonsils are grade 1. And the Stenson's duct, there's no abnormalities. And can you raise your tongue up like that for me? That is the Wharton's duct. And it looks, there's no lesions, no discoloration. It looks good. And we will continue with the ears and eyes on the next video.